Hello, my name's Paul Haslam. I'm a consultant knee specialist working here at the Coriel clinic. I've been a consultant now for nearly 18 years and during that time I've seen many patients with knee injuries. I'd like to talk today about predominantly skiing injuries, which is ironic really because I've just injured my thumb skiing. It's called skier's thumb. I just fell. I felt my thumb go and a few weeks later, I've had surgery. It's a bit stiff, but I'm okay. Worse things happen. Often patients tell me when they injure their knee, they feel something go. And that's exactly what it's like for me. I felt it tear. If you feel it tear, there's probably something wrong. Most skiing injuries are knee injuries. If you look at all joints affected, half of them affect the knee. And often patients will tell me that they're skiing along, catch an edge or they lose control, they feel a snap or a pop and the knee swells immediately. If they try to stand it may feel wobbly. These all suggest that you've torn the anterior cruciate ligament. So what's the anterior cruciate ligament? People talk about the ACL these days. It's in the public domain mainly because of women's football and the high rate of injury that they get in that sport. It's very common to damage their anterior cruciate ligament skiing also. If you look at my knee model here, this is a model of a right knee. I remove the kneecap out of the way. So anterior cruciate ligament, or ACL, is really just the front crossing ligament deep inside the knee. You can't feel it. Anterior means front, ligament means stringy bit holding your knee together, and cruciate means cross. So anterior cruciate ligament. Cruciatus curse in Harry Potter is a cross. There's also a posterior cruciate ligament lying behind it and menisci which you may also damage. So when you actually tear your anterior cruciate ligament, what happens often is you stretch the medial collateral ligament, the whole knee falls off the back and you can see how you can trap the lateral meniscus when that happens. And you're left with a knee which is wobbly. So it moves further forward than it should and it rotates and pivots in an abnormal direction. So what happens if the worst does happen? You injure your knee, usually you can't carry on skiing. Your ski may not have released from its binding. I've seen a bit of a pattern in skiing injuries over the years. It's often a low speed injury where the ski does not release. Maybe in flat light, a blue slope rather than a red or a black. When you may be a bit tired at the end of the day in heavy snow conditions. So if you want to avoid an injury, maybe avoid skiing in those conditions. Usually you can't ski down from the slope. You may need to be collected and brought down and you'll seek medical attention locally in the form of first aid, which will be crutches, maybe a splint, painkillers, and anti-DVT meds are very important. When you get home, you often attend your local accident emergency department. And here there may be a problem because I've seen many patients who've been misdiagnosed in A&E. Unfortunately, the junior staff there fail to recognise the importance of the injury and you may be fobbed off as just having a knee sprain. Knee sprains mean nothing. If you've been told you've had a knee sprain after a significant skiing injury, you really need to see a specialist to get that checked out properly. And an MRI scan normally clinches the diagnosis. If you come and see a specialist here, we would examine you properly and thoroughly and then almost certainly organise an MRI scan. Often you've had an X-ray already in your destination. So if you have torn your anterior cruciate ligament, what next? Well, the anterior cruciate ligament is a tight cord. And when a tight cord snaps, the two ends normally separate and it's very unlikely that that's going to heal. You may have also damaged your medial collateral ligament. Now the medial collateral ligament often does heal. Because it's a broad sheet, it tears like this. And so there is a capacity of the MCL to heal. The meniscus or the shock absorber cartilage may not heal also. So we normally recommend surgery. Some less active patients can just have physiotherapy, but we normally recommend surgery when the knee is settled from the initial injury. And what does that mean? Well, settled means not very swollen, a good range of movement and reasonable muscle function. And that normally takes 6 or 8 weeks to get to the stage where surgery will be considered. If we can't repair the ACL, what do we do? Well, you reconstruct it. And reconstruct means you use something else. And we normally use part of you. There are 3 commonly performed techniques in the UK at the moment. It's either using a hamstring tendon, which is probably the most common, a patella tendon, or now the quadriceps tendon is gaining popularity. Patella tendon graft is a block of bone from the tibia, a strip of tendon from the patella tendon, and then a block of bone from the patella, which is also known as a kneecap. The quadriceps tendon is further up, and you can take that with or without a bone block. Bone heals well into bone, so there are advantages and disadvantages of both. You'd have to discuss the graft choice with your consultant, and I vary my technique depending on certain circumstances, in particular the age of the patient and whether any other additional surgery is required. If you need to take hamstring, for example, for a different ligament, then I might use a different graft choice for your ACL. Normally after the operation, which is done as a day case, there's a long physiotherapy program that you need to follow. It's important that you follow the steps that the physio will guide you through. And this can vary depending on what additional surgery is required. So really the take-home message from this video is if you're injured on the ski slopes, it's an ACL injury until proven otherwise, and that should be checked out properly. And probably an MRI scan will be required. Otherwise, you can risk further damage to your knee. What we do know is that if you're ACL deficient, which means you haven't got an ACL anymore because it's torn, you're much more likely to tear a meniscus. And the chance of you tearing a meniscus is probably about 10% per year. If you tear a meniscus, that's bad news for the long run. You're more likely to get osteoarthritis. Which if you're really old like me, 53, then that's probably not a big issue. But if you're young, and let's face it, the majority of the patients are between 18 and 25, if you get arthritis when you're 40, that's a really bad outcome for you. So I'd highly recommend you get this knee checked out properly.